we're going to be doing some active assisted range of motion. So we're going to do this for 10 times, 10 repetitions, and we're going to do it for 2 sets. And I want you to help me as much as possible with moving your legs while we're doing this range of motion. So we're going to do it nice and slow, just like this, down and up. And let me know if you feel any pain or discomfort, okay? All right, so we're gonna do it a couple more times. We're gonna rest after this, and then we're gonna do one more set. Perfect.
This joint move is an anterior to posterior glide of the tibia on the femur to promote knee flexion. The patient is supine with knee flexed and foot flat on the table. The therapist is to the side of the patient's knee with one hand stabilizing the femur and the other hand as the mobilizing force at the tibial plate. The force is coming from shifting their body weight to the lead leg. This joint move is an anterior to posterior glide of the femur on the tibia to promote knee extension. The patient is in supine and open pack position with a towel under the tibia. The therapist has the mobilizing hand on the femur applying a force posteriorly, and the stabilizing hand is on the posterior aspect of the tibia.
Alright, good morning guys, good morning. Today I'll be doing a manual muscle test on the left knee today. Due to the limitations, I used my work chair and folded this towel to create some support underneath her left leg. Since I didn't have a nice table or a chair, I utilized anything I could find in my house. As you guys can see, I'm doing a manual muscle test on her knee extensors. First, I asked my patient to elevate her leg as high as she can and hold it up in that position. She clearly was able to hold it up there, so that constitutes as a grade of 3. I then asked her one more time to hold it up, but then I flexed her knee a tad just to release the screw home mechanism of the knee. I then applied the pressure and she can hold it up against a grade 5 resistance. Next, we move over to the knee flexors. I asked my patient to move from the chair to the bench that I have in my backyard and place a clean towel for her to lay on. I politely asked her to see how well she can bring her heel up to her body and then requested her to hold it up in that position. I knew from there it was a grade 3. So then I asked her if I was able to place my hands on her hips in order to stabilize her and then be able to do the test. She was actually able to resist my max effort, which constituted for a grade 5. Great job.